All right, the last thing that I want to talk about is is respiratory disorders. Starting off with the common cold. The common cold is caused by more than 200, more than 200 different viruses can cause the common cold. It typically lasts 1 to 2 weeks and is usually transmitted when a person handles an object that is contaminated with a virus and then touches mucous membranes. In humans, this can be caused by three major types of viruses, A, B, and C, each with many different... I've moved on to the influenza, the flu. So the common cold typically lasts 1 to 2 weeks. Influenza / the flu. In humans, it's usually caused by one of three major types of viruses, A, B, and C, each with many different variants. The symptoms tend to be much more severe than those of a cold, and it can be complicated by secondary infections like pneumonia, bronchitis, or sinusitis. Vaccines are 60 to 70% effective. Does anybody know why that is? Why are vaccines against the common flu not 100% effective? The main reason is that there are new strains of flu constantly appearing all the time. The flu can mutate rapidly, and especially the longer we allow it to survive in a particular society, or the longer it survives in a particular host, the more opportunities it has to mutate. When you receive a flu shot every year, you're actually receiving a mix of the most popular strains of flu virus. So the CDC puts together sort of every year, they think, which viruses are going to be on trend this year? And they'll give you a cocktail of a vaccination against those major types. So this is why the vaccines are very effective. Way better than not having the vaccine. Get your flu shots. But the reason why they aren't 100% effective against the flu, as opposed to things like the chickenpox virus or the chickenpox vaccine or smallpox vaccine or anything like that, is because the flu can mutate so rapidly that while you're most likely going to be protected against it, if for whatever reason you come into contact with some bizarre strain, it won't necessarily be effective. So that's the flu or influenza or the flu strain. Pneumonia, interestingly enough, isn't necessarily an infection. It's just an inflammation of the lungs. What happens is flu is going to accumulate in your alveoli. This is going to reduce gas exchange, making breathing very difficult. The bronchioles are going to swell and narrow, also contributing to difficulty breathing. This is usually caused by a bacterial or viral infection. So pneumonia is more of a symptom or a side effect of an infection that you're experiencing. Strep throat, on the other hand, is an actual infection. It's caused by Streptococcus bacteria. Soreness accompanied by swollen glands and fever tend to be the more common symptoms, but it can have very serious consequences if left untreated. Rheumatic fever, kidney diseases. So if you have a sore throat, get a strep test. Get tested for it. And if you are presented positive for Streptococcus bacteria, please make sure to take your full round of prescribed antibiotics. It's very important that you do not let this infection get the better of you. It's not necessarily deadly. It's not necessarily all that severe if you treat it and follow the prescribed course of action by your doctor. So if you have a sore throat, get a strep test. Next up is tuberculosis. Tuberculosis, TB, is an infection caused by the bacterium Mycobacterium tuberculosis, and it's transmitted through respiratory droplets. It can result in fibrous tissue tubercles occurring in the lungs, and it can be fatal. There are many drug-resistant strains that are on the rise, and so it's very important that you get vaccinated against tuberculosis because it can be very difficult to treat, and there are drug-resistant strains that are starting to appear. Cystic fibrosis. Cystic fibrosis is an inherited lung disorder. We've mentioned it a couple of times this semester, and we will probably continue to mention it a few more. It's an inherited lung disorder. It's genetic. It's caused by a single mutation. Mutation affects the chloride ion channels that are found in your lung epithelial cells. That mutation prevents those chloride channels from forming properly and prevents chloride ions from moving back and forth. When chloride ions don't move back and forth, we can't equilibrate with water, and so the water molecules aren't going to move to where they need to, which results in a very thick, sticky mucus on the outside of the lungs that can clog air passageways, that can lead to lung infections. It makes it very difficult to breathe, and without proper treatment, life expectancy is not very long for individuals with cystic fibrosis. Fortunately, there are many treatments out there. There are gene therapies that are working on treating targeting the affected gene. There are small molecule drugs that are coming onto the market soon that are looking at replacing those missing ion channels or those defective ion channels. So there's a lot of research that's going into cystic fibrosis study. COPD, or chronic obstructive pulmonary disorder, is actually just a group of lung conditions that make breathing difficult. There are a lot of different causes of COPD, but the most common one is going to be tobacco use. Tobacco is the most common use of COPD in the United States. Bronchitis and emphysema are the two most common examples of chronic obstructive pulmonary disorders. Bronchitis is an inflammation of the mucous membrane of the bronchi. It can be caused by viruses, bacteria, or chemical irritation, as we've already mentioned with tobacco exposure. Inflammation results in the production of excess mucus. So in this case, we have too much sticky mucus, which can trigger a deep cough. Too much coughing can be either acute or chronic coughing can be ultimately dangerous to the lungs, and it's also very painful. Emphysema is caused by the destruction of alveoli, usually caused by smoking. It results in a reduction in the surface area available for gas exchange and an increase in dead airspace in the lungs. So we'll see on the next slide that we're actually going to find more space, more cavity area in the lungs. However, this is resulting in a decreased surface area to volume ratio. And as we have stated many times, surface area to volume ratio is key. That's what we care about. And emphysema causes an increased volume, decreased surface area. It can be treated, but not cured. So we can treat the symptoms of shortness of breath, but this is permanent destruction of the lungs. Here's what it looks like. So here's what a healthy, normal alveoli looks like. We have lots and lots of surface area for gas exchange. Emphysema causes a breakdown of those alveolar walls, which leads to an increased volume, decreased surface area ratio, which makes it much more difficult to undergo gaseous exchange. The last respiratory disorder we're going to look at is lung cancer. 85 to 90% of cases are caused by smoking and thus are preventable. Lung cancer is one of the most preventable cancers out there, right up there next to skin cancer. The typical progression starts with chronic inflammation of the lungs, ultimately leads to changes in the cells of the airway linings. And then uncontrolled cell division can form a tumor. Once those tumors starts, that cancer can spread to other parts of the lungs and the rest of the body. The lungs are a passageway for anything from the outside world to get into your body. But your lungs are also lined with capillaries that are going to transport those gases to the heart and then to the rest of the body, pumped out to the rest of the body. If small bits of tumor break off and enter the bloodstream at the lungs, they can then be transported to pretty much anywhere else in the body that the blood is going to travel. So lung cancer can be very deadly, and it can spread rapidly throughout the body. Here is a lung that is riddled with tumors. And that's it for this chapter. You should be able to list the 4 functions of the respiratory system, list the organs or the structures of the respiratory system, explain their role in gas exchange, and then identify various disorders of the respiratory system, including their symptoms and treatment. I specifically want you to focus on one homeostatic imbalance of the respiratory system. Look after it, figure it out, learn it, and be able to tell me what you know about that particular homeostatic imbalance. All right. Thank you for your time.